I have uneven eyes. My left eye seems to be more protruded outwards than my right eye. Can this be made even?
Thank you for your question. You've submitted a photo and a question saying that your eyes are uneven and that one eye is more protuberant or bulging than the other eye. And you're asking what can be done for that. Well, unfortunately, with the limited nature of your question, I have to ask more questions to get a better detail in a way that would help you understand the best choice of what to do. I'll explain to you a little bit of what I mean. I'm a cosmetic oculofacial plastic surgeon. I've been practicing in Manhattan and Long Island for over 20 years. This means my background training was first in eye surgery before I did specialized training in oculoplastic or oculofacial plastic surgery. This is surgery of the eyelids, the orbit, the bones around the eye and the space in the eye socket, the lacrimal system, and the face. So dealing with eyes that bulge is a significant part of what is under the specialty of oculofacial plastic surgery. And the most common issue that we deal with is something called thyroid eye disease. Now, thyroid eye disease is a condition, and I'm not saying that this is the situation for you, but it's important to learn about the causes of an eye being bulging. But thyroid eye disease being the most common in terms of just the general number of possible causes is a disease where certain antibodies will actually cause the thyroid hormones to change, as well as the position and appearance of the eyes to change. It's also referred to as Graves' disease. Now, going back to the question you submitted, the first thing I would ask you in my practice would be, is this a change? Is this different than the way you looked a year ago, or 2 years ago, or 5 years ago? If this is a change, then you need to seek you see an ophthalmologist as soon as you possibly can. It's very important to at least make the right diagnosis, because a change in the eye position, the eyeball position, is something that needs to be evaluated. Everything from, and usually that goes with some type of an imaging study, like a CT scan, CAT scan, or MRI study. Because we always want to rule out some kind of mass, and it could be benign or malignant, and it could be as well as conditions such as thyroid eye disease. Now, let's, for argument's sake, say that this has been a stable appearance. Then it's possible that the shape of your eyeball is a longer shape. It's commonly seen in people with it's called high myopia, or very nearsighted. The eyeball, instead of being more of an egg shape, is more like a football shape. But again, it goes back to the history and the symptoms and doing a proper ophthalmic examination. Ophthalmic examination would include getting vision and testing, as well as looking inside and inside the eye, as well as taking some measurements of the relative projection of the eyes, and other things that can't be done by just looking at a photo. So I think you need to educate yourself about these causes, schedule an appointment with an ophthalmologist to get the diagnosis. I can tell you that we have done a lot of treatment of patients with thyroid eye disease, and just as an example, and we've been able to do things as minimal as doing eyelid surgery to reposition the eyelid to make the eyes look more symmetric, to doing something called orbital decompression to get the eyes to go inward. Again, these are all contingent on proper diagnosis. So we don't need to get ahead of ourselves at this point, but at least education and some knowledge and insight as to this being a change, and then getting the right first line of evaluation is very important, so that you can have a plan at some point of what will work out best for you. So I hope that was helpful. I wish you the best of luck, and thank you for your question.